Hello, and I'd like to welcome people to another in the series of the Psychodynamic Pathway series brought to you by ICAPP. Today it's my pleasure to be able to interview and introduce Marc Chaussivert. Just briefly, Marc has worked for many years as a clinical psychologist and has undertaken his child and adolescent psychotherapy training with ICAPP. He's worked with for many years with children, adolescents and their families, with refugee backgrounds especially, and also with aboriginal children and families. He currently works at STARTS, which is the New South Wales Service for the treatment and rehabilitation for torture and trauma survivors, and also at Gunawirra, which is an early intervention aboriginal service. Marc also has a private practice here in Sydney. So Marc, I'd just like to start really, which I ask everyone at the beginning, is if you could just really tell us your pathway in terms of how you found out about this model and how you ended up sort of thinking this way and working this way.
Yeah, thanks, Peter. Yeah, I mean, it goes back a long way, but I think my most distant recollection about this is that I first studied Freud in philosophy, not in psychology and not in any other discipline. It was actually philosophy, and the reason Freud was taught, I remember the lecturer saying that Freud was a very interesting figure to study because he kind of was bringing a different view of human nature in terms. What he was arguing was that he was quite interesting in terms of Freud was quite interesting in terms of his kind of thinking after the Enlightenment, where people had been seen as basically good and constantly kind of progressing, and Freud was introducing this idea that there was another side to human nature, and that was very interesting, and that was my first exposure to psychoanalytic ideas, and then in psychology, I think. At the University of New South Wales, there were some modules in psychoanalysis, even though it was a very behaviourist. And I say behaviourist because it really was the cognitive behavioural therapy was just sort of taking off at that time in the early 80s. And that was the main sort of emphasis in that course. But I remember there was a unit, a very popular unit, taught at that university. I remember being exposed to psychoanalysis in that way. So they were my early experience, and they my early experiences. And then there were people I came across who supervised me at various points, who sort of would introduce a few ideas. And I remember at STARTS there was a person there that worked psychoanalytically, and I was quite struck. I can remember there was kind of a discipline around the way she worked in terms of. It seemed that unlike some of the other workers, the relationship, the emphasis on the therapeutic relationship was really, she put a lot of emphasis on that, and and the kind of impact that had. And it seemed to me that was very important, particularly in working with people who were very traumatized. That there was kind of, I sort of admired that kind of discipline and the amount of how she brought that to the fore and how important that was in the work, and that emphasis on the therapeutic relationship as opposed to just thinking in terms of specific techniques that were going to bring about some kind of change.
When you say discipline, can you say a bit more about that? What do you mean by that she put a discipline? You mean to the supervision or to the work as well?
Yes, that in a context where there was a lot going on and there was a lot of chaos and a lot of trauma, that you made sure you were there on time,
right.
That you made sure you met people regularly every week. I remember one of the things she said to me was that for many of the people you work with who still have, one of the things about that work at STARTS was that the people's trauma was far from over. And that's another whole discussion, how that sort of challenged a lot of these views of traumatic, a kind of a traumatic experience that existed in the past and was now over. In many ways, for many of these people we were working with, their lives remained quite chaotic. They were still incredibly worried about people that were left behind overseas. They were worried about trying to resettle in Australia. Some of them were asylum seekers, so they were very concerned about potentially being sent back to these places they'd escaped from and were terrified terrified of returning to. And what this person was saying to me is that one of the things you can give people is this sense that there's at least that one place once a week where they can go and they'll have that space with you, and that will be a kind of regular, reliable thing. You can't promise more than that, and perhaps and sometimes we would talk about how people aren't necessarily getting better, but at least you're offering them something that might hold them. That idea of holding as well, I think, was important. I know these are different kinds of ideas in psychoanalysis, so that they're not completely equivalent, but that sort of containing and holding idea was very important. So maybe discipline's one aspect to it, but I just remember sort of admiring her and thinking, you really are focused, when some of the other people were fairly chaotic. I think they were influenced by the trauma work, actually. I think, but she maintained this kind of reference point, this kind of way of doing the work, which, and I think, she linked that back to the psychoanalytic ideas. Yeah.
So she sounds quite a powerful influence.
Yes.
Did you then start thinking, well, I could start use this way of thinking directly in the work? Because I guess what strikes me with the trauma and torture people is that it is so external in the sense of these horrible, horrible traumas that they've gone through. And the idea of, I guess, of, well, where does the place of an inner world fit in with that,
Yeah.
I mean, how have you felt about that? How have you seen yourself applying this sort of funny mix of internal world and yet dealing with the external world as well?
Yes, yeah, that's a difficult question. I mean, I think you have to juggle the two. You do have to. I mean, it is always about the way people, the sense people make of their experiences. So I guess that's another important part of a psychoanalytic approach that is shared with other. It's not unique to psychoanalysis, but the emphasis is on meaning rather than just stimulus response, or in a kind of behavioural sense. It's about how someone construes their experience. That's always important. So there is this internal world aspect, but it is about real events in the real world, and in trauma you're really confronted by that. Mm-hmm. So I think that sometimes is a limitation of some psychoanalytic thought, that it gets sort of lost in the inner world. You do need to have both of those, and I've probably been drawn to influences that take account of that external real world, those real world influences as well, and thinking about how they are significant and the sense people make of that.
How did you? Was it a matter of just falling into the job with starts and refugees, or do you feel there was something in your background? Had you done previous stuff that sort of related to that, or was it just the job that was going and you took it from there? How did you do that?
Yeah, no, not at all. I mean, I had an interest in human rights, and I'd studied psychology, and my ideal was to have a job that sort of brought those together, so I had met people at Starts prior to working with them. I'd gone to visit out of interest. I'd gone to some of their clinical meetings. This is the sort of towards the mid-90s actually. And I'd met people there, and then a position came up and I applied for it, and I was able to secure a position with them. So yes, I did have this pre-existing kind of interest in those kinds of issues. I'd been involved in human rights work and what we called then sort of solidarity work, which involved supporting struggles for human rights and for people in certain countries who were trying to achieve a better life for themselves, in countries where there was great hardship and conflict and war. So I'd been involved in that. I remember being, involved at the margins of certain struggles in the late 80s and 90s, the anti-apartheid struggle as well. So I'd had this kind of interest in those sort of political things. So Starts kind of brought those interests together in a way.
Yes, and it sounds from your background there was the interest both in the internal and the external.
Yes, you could say that. Absolutely.
How, I mean, applying this model to particularly that clinical population, I mean, I know you've done private work, so do you feel you work differently in that setting than you do in your private work, or if you've been, many years sort of in a sort of community health centre or something, and it wasn't necessarily focused on trauma and torture? I mean, what do you think there are particular things that that working with that group that would be different to working with, a non-traumatized, non-refugee sort of group of people?
Yeah. Question.
I'm sorry about that technical hitch where the link dropped out. Mark, I was just asking Mark to link us in again about this issue of did he feel that there's any difference in the way he worked with, say, a refugee population versus a non-refugee population? So I wondered if you could comment on that, Mark.
Yeah, I was just that little break gave me the opportunity to think about it a bit more. I mean, I think in a way, a kind of psychoanalytic frame is to not, sort of lump people together and think, everyone, there's a kind of a level of individuality, if we can call it that, of subjectivity so everyone's different. So obviously there are things that are very specific to, to refugee people. To the extent that we can generalize, we might say that often the trauma, there's a magnitude to the trauma that is more significant, but that may not always be the case. Other people have different kinds of trauma. Certainly working with people of Aboriginal background as well, there's a different kind of trauma, across generations sometimes. And sometimes my experience has been that with people of refugee background, if they, that there is a truth that if they've had that kind of early, quite a positive early experience in their lives where they felt loved and cared for, that it does put them in a much better position than someone who hasn't had that, who's had a much more difficult early childhood. So having said all that, I mean, what I would say is there's one thing that I think has been helpful with a kind of psychoanalytic, psychodynamic approach is that emphasis on the relationship helps you perhaps, stay with very difficult kinds very difficult presentations is probably the wrong way to put it, but where people are acutely kind of distressed and really struggling, you kind of can stay with that rather than thinking you have to come in with some sort of technique or something that's going to fix things. You're more able to reflect on how it's impacting on yourself, because that is part of the interest in that approach, is to reflect constantly on how you're kind of reacting and responding. And so kind of have a frame in which to, if you're finding that distressing, you can reflect on that rather than kind of react to your own reactions, if you like, if I can put it that way. So I think that's very helpful. And as a way of answering that, there can be a level of intensity to the distress, and so it's useful to have that kind of frame to work with that. I mean, I can think of a teenager I worked with once who was very, I think, very traumatized and was very angry about, amongst the different reactions that she was very angry about coming to see me, and had a lot of anger about what had happened to her in the world. And a lot of that was felt when we met. And, the psychodynamic approach kind of gave me a way to think about that and to not sort of take it too personally, and to not react to it, to try and sit with what that was communicating about her experience, I guess you could say, as well.
Has that evolved? Because the question I wanted to ask is, if you look back on when you first started working and how the way you work now, what things do you think have changed either in your thinking or way of working?
Yes, I think over the years I've become more able, I hope, to just sort of sit with things and to try and see what emerges and not try and come in too quickly with some sort of a particular kind of specific approach, if you like. Yes, I mean, it's hard to sort of look over the years. I mean, I guess there are slow incremental changes. I think I'm always learning. I think you never stop learning. But yes, I think that would have changed. I think the sort of work, using a sort of more broadly playful approach has increased in my work. So if I can think of another case, I recently, when I say recently, about 18 months ago, I started working with a boy who'd been very violently kind of acting out, made threats towards others and himself. And just that idea, trying to make it playful as much as we could, because I just knew if I didn't find a way to link in with him and what something that he kind of liked in the world, then we would never have, there would be no therapy. It would end before we began. So trying to find ways to play, and there were ways that we kind of eventually we were starting with what was interesting to him, but then making sort of developing stories, and he drew some things, and then we'd sort of invent stories out of that. And it was fascinating how that kind of paralleled his experience, but he would never speak explicitly about his actual experience.
Do you find that's the case, that with a lot of the children, you wouldn't directly talk to them about the trauma? You may have been told what trauma they've been through, but
yes.
that issue of, do you address it, or do you just give a space to see whether they bring it up or not?
Yes, look, certainly I think it's important to have a space that people can bring up what they want. I think that's a very important principle, that they have as much control over the processes. But yeah, I don't think you'd bring it up. I wouldn't suggest that. Certainly I wouldn't bring it up unless they do, and I would try and work very non-directively with children. I find is much more effective. Sometimes with toys, with art materials, and with older people, it might be about the kinds of interests they have and things that are important to them in their lives, and utilising that as a kind of a way to explore what they're struggling with.
So you wouldn't get into talking to them about breathing exercises, or them where or when do they get anxious or fearful or worried or whatever. You would sort of just, because that in a sense, I guess, would sort of impact upon that space in a way, whether you had an agenda where you wanted to do something. So you feel generally you wouldn't go in with that sort of agenda, because I assume a lot of people with traumatized children are doing that.
Yes, I wouldn't rule that out, but I certainly wouldn't start like that unless someone was acutely distressed. If they were highly anxious and very distressed and couldn't even establish a kind of window to talk about anything, then you need to get there first. I think that's true. I think, people, you will need something else. And I'm not saying that I only work psychoanalytically. I think I kind of think the metaphor would be of having a kind of toolkit, and some of the tools are kind of psychodynamic or psychoanalytic tools, but there are others as well that I would utilize. So I wouldn't rule out breathing exercises, or, sometimes you do get someone that wants to focus a bit more on what they're sort of struggling with in terms of their reactions in the world. So, you could focus on that, and also refer, sometimes bringing in there have been cases where I've brought in a psychiatrist as well and worked alongside them, or some other kind of professional where it's appropriate. People that have specific kinds of physical difficulties, and maybe that we do have physiotherapists that starts, and there are times when I've worked with them as well. Yeah.
So you're not. That does sound if you also are thinking about the body as well as the mind.
Yes. The body, the mind, but also people's social context. So I think I've become increasingly interested in how we might think about that as well, and think about the family, for example. To some extent, when I mention the word holding, you're holding something. You're trying to kind of hold the person in a way if they're acutely distressed, like what I said at the beginning in terms of, having these very consistent appointments but you also have to think about what they hold for, if I think of what a child might hold of the distress in its family, for example, to think beyond just them, and to think of the trauma in that family as well. So
Right.
what they're holding as well, and what they're bringing, and ultimately beyond that, people are traumatized, communities are traumatized. So we need to think about that as well, and how that's shaping what they're bringing to you. That it's not reducible to just something in their mind.
Right. Yeah. Yeah. I mean, in your development, have there been particular either authors or papers or books, bits of literature that you feel have really influenced you and sort of held in good stead throughout your career?
Yes, I mean, throughout's kind of hard. You can think of things it's more what I'm reading more recently. I mean, there are authors I can remember when you ask me that question. I mean, there was a time when I was reading an author that sort of stands out for me is Stephen Frosch in the UK, who's put a lot of emphasis on bringing a more psychosocial approach. Was very I taught at the Tavistock for a while, and then set up a school of psychosocial studies in London, and sort of, again, because he brings in his interest in sort of colonialism and those broader questions that I think shape some of the work that I do, and issues of race, working with people who are racially different, culturally different. So it gives you people like Adam Phillips.
Just on the Frosch, was that just a number of papers or a particular book? And it's Frosh.
That's correct. Yes. No, I can't think of I mean, he's written a lot of, quite prolific. There are a lot of books about transgenerational trauma, but he has, some of his articles are free on the internet if you do a search. And
Right.
There's one fairly more recent one on colonization, and where there's a kind of an analysis of the kind of colonial ways of thinking within the history of psychoanalysis as well.
Mm-hmm.
So it's quite an interesting article. But there are other people, I mean, they're from different traditions. Christopher Bolus as well, I found interesting. Adam Phillips, different people. Anne Alvarez has influenced my work. I think it gives you a way to work with children, a way to think about working with children differently to perhaps the orthodox psychoanalytic way. And that's been very helpful. I've recently become interested in other kind of traditions. The sort of the Lacanian tradition, and I came across someone who's not a clinician, but sort of makes those ideas a bit more accessible for me anyway. A woman called Marie Ruti, and there was a lovely kind of free podcast with her discussing with a client, someone of a more Kleinian background, and they're having a kind of a very sort of productive dialogue about the two different traditions.
What's her name? Could you spell it?
Marie Ruti. So I think it's spelled Marie, M-A-R-I, and Ruti, R-U-T-I.
Right.
And so she's written a number of books. I've just come across them recently, but there are many. It kind of depends where I'm at the time that someone asks me the question. But
right.
Yeah.
What I mean, looking back, I mean, if someone was starting out now, what advice would you give them in terms of if they were interested in this sort of way of thinking or this model? What advice would you give them?
Well, I mean, I think you need to find a way into it, but remaining, I mean, you probably need to remain fairly open to different. I would suggest people not be closed to different sort of perspectives and traditions.
Right.
Possibly find yourself a supervisor that, someone that can give you some supervision that's that you feel you kind of connect with, rather than being too worried about a formal training straight up.
Right.
And explore for yourself a little bit. Maybe go to some seminars and see if it works for you. And that's an interesting question. If I think back about myself, it was being slowly exposed to things here and there. I mean, of course, I studied in a different environment where a lot of these things were much freer, in a purely financial sense. And nowadays, people are more constrained because they have to make choices, particularly when you're starting out, perhaps less financially well off. And that's a shame, I think, sometimes that some of the seminars seem pretty expensive. And so maybe reading around, looking at like I said, the free podcast. There are some free podcasts out there that you can hear people without having to pay. There are people that put articles out there for free as well. There are a lot of, so I would suggest people do that first and sort of work out what they're drawn to. And
how would they find those? Would you just Google sort of analytic articles or analytic podcasts or
psychoanalysis? So for the podcast, I'm thinking there's one, it's books. in psychoanalysis. I don't know, it's based in the US. There's that one. There's the Freud Museum in London. Sometimes has interesting things.
Right.
They're free. I think you type in podcast psychoanalysis and they'll come up.
Right. Right.
You know, you maybe come across an author and can type the name in.
Mm-hmm.
You can put in free articles. Yeah,
Right.
I think people, you do come across them if you do a bit of a search.
I mean, while we're talking about more modern technology, I guess the last question I wanted to ask is just your thoughts on where do you see this model going in the future? There's always been this worry it will eventually die out, or I guess I'm particularly thinking about children and adolescents. And your thoughts, do you think in 50 years' time this will be unheard of, or what are your thoughts about that?
Yeah, no, I don't think it'll die, but it will evolve. It'll change in the same way as, you know, people thought very differently 100 years ago, 150 years ago. So probably people will think differently, and people will think differently because of the context in which they're developing their thoughts as well. But I sort of see a future for it. Absolutely. I think it's a lovely way to work with people that is sometimes more respectful of the person, of being curious about them and as I said earlier, the meaning that things have for them, being really open and receptive to them rather than trying to come in, you know, having ready-made kind of answers about what the story is. Yeah. It really is about exploring with them what the issues are rather than having predetermined responses. I think that's, you know, this idea of the unconscious in psychoanalysis is very much about that. This what we don't understand. There is a big part of experience that we do not understand, and we need to be receptive and open to try and help the person understand that for themselves. As you know, and we never understand it fully, of course, but you know, the point is that it's a more open way of working, I think. Yeah.
Well, thank you very much for that. I guess what's unique in your position is having this, I was going to say struggle, but this interesting intermingling of external world and internal world, and you're broadening it out even to, you know, to the broader community, to the frosting about colonisation, and I know from my contact with you that interesting mix of the social, the philosophical, and the psychoanalytic, I think makes you very unique, and I think we're very lucky to hear your thoughts from that perspective. So thank you very much.
Thanks, Peter.
Bye-bye.
Bye.